do a lot of, apart from clinical work, you do a lot of residency program. You win a lot of award like the Outstanding Faculty Health Award, and some adjunct assistant professor at the Duke NUS Medical. So where do you find time to sleep?
No, so that's what the topic is today, right? So it's about what sleep is, how important it is, and why we should prioritize it. So
regardless of your very packed schedule that I can see from my research, you can still find time to sleep. There is a way to sleep.
You always find time for things that you enjoy doing. Yeah. Number one is set a routine, have a schedule. Actually, it's very interesting, this first point, because I just updated my Samsung handphone. Then I realized now the alarm feature also puts there to set a time to go to bed.
Yes, the new models, right? I have the same one.
Yeah. So actually there is a greater awareness, so much so that all these tech companies also catching on. So this is one of the tips for better sleep. So you should set a schedule. Your body actually works better with a schedule. It's no good if one night you sleep at 11 p.m, next night you sleep at 1 a.m. It's not good for your body, and it's very hard for you to sleep in such a situation. So set a schedule is number one. Number two, avoid stimulants like caffeine, nicotine, avoid excessive alcohol in the evenings.
The word here is excessive. Okay.
Yeah. Actually, any caffeine
glass of wine should be fine.
But coffee, tea after dinner is not a good idea if you're going to
but Chinese
go to
think
bed.
That after dinner you should drink tea. When you go to those Chinese restaurants, very expensive ones, right? They always serve you pu la, oolong all this.
So nowadays I ask for Qihua.
Oh. Yeah.
So chamomile tea, chrysanthemum, all these are teas that white teas that don't contain caffeine.
Again, chamomile and who?
Chrysanthemum.
These two Qihua and chamomile.
I'm sure there are a lot of other herbal teas out there, herbal teas that don't contain caffeine. But these are the two main ones. Then the third one is to have adequate sunlight exposure in the daytime. So in the midst of the pandemic, when people were all staying home, especially those people in the US, the UK, right, when they're locked up at home and the minimal sunlight exposure, it's actually very bad for circadian rhythm, because your body actually responds to sunlight and the lack of sunlight by producing various hormones that are essential for sleeping. So one of the crucial ones is actually melatonin. So you need to avoid light or blue light as far as possible in the evening before you go to sleep. Have a cool down period. Actually,
sunlight is so important. I had another webinar with our In Conversation, and the doctors say that it gives you all the vitamins and
that's right.
So adequate sunlight is actually quite important for all sorts of reasons, inclusive of this today.
Yes, for sure, for sleep as well. So you will find that there's also a reason why people feel down and more difficult to sleep in certain more northern and southern, more temperate climates, especially during winter, because there's the hours of sunlight is much less, compared to us in the tropical areas. So sometimes because of those variations, they find it harder to sleep as well. Have a cool down period before bed. So turn things down, quieten down at least 1 to 2 hours. Don't go and engage in the strenuous activities. Don't go and dance, go nightclub dancing.
K-drama that make you so sad, Why did she not marry him? Why did she marry the other guy?
So you have all these strong emotions, you take it to bed with you, then you find lying in bed thinking over and over and wondering why you cannot sleep.
Also don't watch those scary show, right? Those, Halloween type, the killer type, right?
Yes. Then avoid screen time. So that's one of the harder things to avoid, right? All of us are addicted to our smartphones, TV.
I watch until I fall asleep.
So that's not good as well. That's really not good. And then try to just limit your bed for sleeping only. Except maybe one other activity, but sleep.
At what point do you recommend surgery on tonsils versus CPAP treatment? APAP or CPAP, which is better? I answer for you this one. You have to go and see Dr. Heah. There are 3 questions that I feel that is absolutely quite essential. I hope you don't mind that I address them. One is, my family member is choking in his sleep about once or twice a month. Is a check necessary? I think if he's choking once already, you need to check. I don't know what you think of that.
Yeah, because you think about it, that's the episodes that you actually notice. The question is, how many times does it go unnoticed? And that's what a sleep study can provide. How often this occurs when the person is actually sleeping. Mind you, you only know what you pick up. You don't know the times that you're not watching that person. The person might also be joking
also.
You're
not watching, then the person choke.
He might also be joking when you're not watching. So
the answer is absolutely, please bring him to the doctor tomorrow. Is there a golden hour for sleeping? Is there certain I don't know, you call it rumors or myth that certain timing repairs certain organs when you sleep? Medically proven?
No. So there's no evidence to show there's a golden period for sleeping. But we do know that the body, all of us have circadian rhythms. So it's rhythm of day and night. The various hormone and brainwave activities vary based on that. Most of the time it's around 24 hours. Some people it's a bit longer, some people it's a bit shorter, depending on our activities and our own bodies. The problem is that if you do shift work, all these things, circadian rhythms are thrown off and disrupted. So your whole sleep architecture, sleep quality, sleep cycle, all that might change as a result of that. So as long as you are able to stick to a particular routine or schedule,